Retinal detachment. Introduction. Retinal detachment is a serious ophthalmic emergency where the retina separates from the underlying retinal pigment epithelium and choroid. This detachment disrupts the retina's blood supply, leading to vision loss if not treated promptly. The condition is primarily associated with trauma, aging, or underlying retinal disorders and requires urgent medical or surgical intervention to prevent permanent vision loss. Definitions. According to the American Academy of Ophthalmology, retinal detachment is a condition where the retina is lifted or pulled away from its normal position. The World Health Organization defines retinal detachment as the separation of the neurosensory retina from the retinal pigment epithelium, leading to visual impairment and requiring immediate medical attention. Risk factors. Advanced age, more common in individuals over 50 years. Family history, a genetic predisposition increases the risk. Severe myopia, high myopic individuals have elongated eyeballs, making them more prone to retinal tears. Previous eye surgery, cataract or glaucoma surgeries can weaken the retina. Trauma, blunt force trauma can cause retinal detachment. Systemic conditions, uncontrolled diabetes and hypertension can damage the retinal vasculature. Inflammatory eye disorders, uveitis and scleritis may contribute to detachment. Etiology. Retinal detachment is classified into 3 types based on its cause. 1. Rhegmatogenous retinal detachment. This is the most common type of retinal detachment and occurs due to a break, tear, or hole in the retina. The retina is a thin, light-sensitive layer at the back of the eye, responsible for converting visual signals into neural impulses. In rhegmatogenous detachment, a tear in the retina allows the vitreous humor, the gel-like substance inside the eye, to seep through and accumulate beneath the retina. The fluid pushes the retina away from the underlying retinal pigment epithelium, RPE, leading to its detachment. Over time, as the detachment progresses, the affected area of the retina loses its function, resulting in vision loss. 2. Tractional retinal detachment. This type of detachment occurs when scar tissue or fibrovascular membranes develop on the retinal surface and exert traction, pulling force, on the retina. Over time, the scar tissue contracts, pulling the retina away from its normal position. Unlike rhegmatogenous detachment, tractional detachment does not involve a retinal tear or break. It is often seen in conditions that cause abnormal blood vessel growth, such as diabetes-related eye diseases. 3. Exudative retinal detachment. Unlike the other types, exudative detachment occurs without a retinal tear or traction. It is caused by fluid leakage from blood vessels or inflammation, which accumulates under the retina and lifts it away from the underlying layers. The fluid buildup disrupts the normal attachment between the retina and the RPE. Pathophysiology. Retinal tear formation. A break in the retina allows vitreous fluid to pass through. Down arrow. Accumulation of subretinal fluid. Fluid collects under the retina, causing separation from the retinal pigment epithelium. Down arrow. Detachment of the retina. Loss of retinal attachment disrupts photoreceptor function, leading to vision impairment. Down arrow. Progressive vision loss. If untreated, the retina loses its ability to transmit visual signals to the brain, leading to blindness. Clinical manifestations. Symptoms of retinal detachment develop suddenly and include floaters, sudden appearance of black specks or cobweb-like structures in the visual field. Photopsia, flashes of light due to retinal stimulation. Blurred vision, progressive worsening of central or peripheral vision. Curtain effect, a shadow or curtain obstructing part of the visual field. Metamorphopsia, distorted vision making straight lines appear wavy. Painless vision loss, progressive without pain, distinguishing it from optic neuritis or acute glaucoma. Diagnostic tests. History taking. Chief complaint, sudden vision loss, floaters, or flashes of light. Past medical history, previous retinal detachment, high myopia, eye surgeries, diabetes. Family history, any relatives with retinal disorders. Trauma history, any recent blunt or penetrating eye injury. Medication history, use of anticoagulants, corticosteroids. Physical examination. Fundoscopic examination, direct visualization of the detached retina. Slit lamp examination, detects retinal tears or vitreous hemorrhage. Visual acuity test, determines extent of vision impairment. Ultrasonography, B-scan used when media opacity obscures direct visualization. Advanced diagnostic tests. Optical coherence tomography, OCT provides high-resolution cross-sectional imaging of the retina. Fluorescein angiography, assesses retinal circulation and identifies vascular abnormalities. Electroretinography, ERG evaluates retinal function by measuring electrical responses of photoreceptors. Tonometry, measures intraocular pressure to rule out associated conditions like glaucoma. Medical management. Pharmacological management. Corticosteroids, prednisolone, dexamethasone used to reduce inflammation in exudative retinal detachment. Nonsteroidal anti-inflammatory drugs, NSAIDs helps manage pain and inflammation. Antibiotics, if infection is suspected, prevents or treats bacterial infections that may worsen retinal conditions. Anticoagulants, for patients with clotting disorders, used cautiously to prevent vascular complications that could lead to further damage. Osmotic agents, mannitol, acetazolamide helps lower intraocular pressure and reduce fluid buildup behind the retina. Non-pharmacological management. Cryotherapy, a freezing technique that seals small retinal tears by creating scar tissue, preventing further detachment. Laser photocoagulation, uses a laser to create burns around the retinal tear, forming scar tissue that helps secure the retina. Pneumatic retinopexy, involves injecting a gas bubble into the eye, which presses against the detached retina, helping it reattach while the tear is sealed using laser or cryotherapy. Postural management, patients may be advised to maintain specific head positions after procedures like pneumatic retinopexy to help the retina heal properly. Eye protection, patients are encouraged to avoid activities that increase intraocular pressure, such as heavy lifting or straining, and to use protective eyewear to prevent injuries. Surgical management. Scleral buccal surgery involves placing a small silicone band around the outer layer of the eye, sclera. This band helps reduce traction on the retina by gently pushing the eye inward, allowing the detached retina to reattach properly. Vitrectomy is a surgical procedure in which the vitreous gel inside the eye is removed. This helps eliminate any pulling forces on the retina, making it easier to reposition and seal the retinal tear. The eye is then filled with a gas or silicone oil to keep the retina in place during healing. Silicone oil/gas injection is used after retinal surgery to maintain attachment. A gas bubble or silicone oil is injected into the eye, applying gentle pressure on the retina to keep it in place while it heals. Silicone oil may need to be removed later, while the gas bubble dissolves on its own over time. Dietary management. Vitamin A, carrots, spinach promotes retinal health. Omega-3 fatty acids, fish, flax seeds reduces inflammation. Lutein and zeaxanthin, leafy greens, eggs protect against oxidative stress. Nursing management. 1. Nursing diagnosis, risk for impaired vision related to retinal detachment. Interventions. Monitor visual acuity and report any changes immediately. Educate the patient on the importance of early symptom recognition, such as flashes of light or floating spots. Encourage compliance with post-surgical positioning to facilitate retinal reattachment. Provide protective eye shields to prevent accidental injury. Advise the patient to avoid activities that increase intraocular pressure, such as heavy lifting or straining. 2. Nursing diagnosis, risk for anxiety related to vision impairment and surgical intervention. Interventions. Provide clear information about the condition, treatment options, and expected outcomes. Encourage the patient to express their fears and concerns regarding vision loss. Offer emotional support and involve family members in patient education. Refer the patient to support groups or counseling if needed. 3. Nursing diagnosis, risk for injury related to impaired vision and depth perception. Interventions. Ensure a safe environment by removing obstacles and providing adequate lighting. Assist with mobility as needed, especially after surgery. Instruct the patient to wear protective eyewear to prevent accidental trauma. Educate caregivers on assisting the patient with daily activities while minimizing fall risks. 4. Nursing diagnosis, deficient knowledge related to post-operative care and activity restrictions. Interventions. Teach the patient proper post-surgical positioning, such as face-down positioning if required. Instruct on the use of prescribed eye drops to reduce inflammation and prevent infection. Explain the importance of follow-up visits to monitor retinal healing. Educate about symptoms of complications like increased eye pain, sudden vision changes, or redness. Conclusion. Retinal detachment is a serious ocular condition requiring prompt diagnosis and intervention. Advances in surgical techniques have improved outcomes, but early detection remains critical in preventing permanent vision loss. Regular eye check UPS and patient education play a vital role in managing and preventing retinal detachment.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.